Hi, I am Dr. Sidharth Verma and welcome to this educational video. The topic of this educational video is how to avoid a spine surgery. So, you have been suffering from some kind of back pain, or you have got some injury, or maybe you have a mixture of both, or maybe you did not have anything but still you are undergoing a spine surgery, or you are posted, or you are thinking, or somebody has advised you for a spine surgery, and you have seen your friends or your relatives suffer because of this spine surgery, or maybe the surgery was not successful and you are very afraid now what to do. So, do not worry, we are here to help you, and an interventional pain physician or a spinal pain specialist can definitely help you in this case. And what you need to do is just go to him and tell him that what disease you are suffering from, and he will help you. Now, what is the logical approach in how to avoid a back surgery, as the title of video says? First of all, prevention is better than cure. So, you must stay fit and stay lumbar. By staying lumbar, I mean that your back should be flexible. Most of the back injuries, strains, sprains, they occur because the person is not very flexible, and if you are not very flexible and you have to do even a trivial work like maybe getting a file from a cabinet, lifting a 10 kg load, maybe some gunny bag or some small bucket full of vegetables or something like that, this trivial work can lead to a strain. Repetitive strain can lead to various issues with your back, which can be as trivial as a myofascial syndrome, in which your muscles are affected, or as severe as a disc herniation. So, in my other video you can see how I have described various pain generators in the back, which you will find on this website, or you can visit my website on www.pain.org.in. Okay. But for this video we will concentrate on how to avoid this. So, first step is prevention. So, if you can prevent it by staying fit, by controlling your weight, by physical activity, by following correct techniques of lifting weights, then of course this is the first step. Now, supposingly that you are suffering from backache. Now, second step is early treatment. So, if you know that you have been suffering from backache, I am not talking about the backache which happens once in a while, but if the back pain is persisting, 1 week has passed, 2 weeks have passed and you still having back pain, so then do not ignore, do not think that this will pass or I will get better by the day, let us do some work and something like that. Immediately go and seek treatment. You visit a spine and pain specialist and talk to him about your problem, and I am sure he will be able to sort it out. Now, the next step, supposingly you did not pay heed to what your doctor said, you continue to gain weight, you continue to be lumbar, be non flexible, and still you had this kind of pain. Of course, you will have this kind of pain, and now the problem has increased and magnified, and you go to a surgeon one fine day and he suggests an MRI, and there is a big bulging disc and it is compressing on your nerves, and now your doctor says you need a surgery. So, can you avoid this surgery? In many cases yes you can, and in many cases you cannot. So, when you can and when you cannot, it depends on the opinion of your treating surgeon and your spine and pain specialist. So, in the cases where your spine is unstable, means there is a bony instability, then definitely you will need to have a fixation done, or in some way the bony instability needs to be fixed. By bony instability I mean that your this small bones which make up your spine are not in a straight line, there is some movement which is happening while you flex or extend your back. Okay. So, if this is not there, then in most cases you can avoid an open surgery. And how it can be done? It can be done with as trivial a procedure as an transforaminal neuroplasty procedure, wherein you just need to come lie down on your back under an X-ray. The spine and pain specialist will simply give you a drug which will reach your nerves and cause the subsiding of the inflammation which is there due to the compression, and your pain will be relieved. Number 2, in nowadays we have a very nice procedure which is known as endoscopic foraminoscopy or foraminoplasty or endoscopic diskectomy. This is a very novel procedure which is done by the spine and pain specialists, and in this procedure what we actually do is we just give a small nick of the size of maybe smaller than a centimeter also, then we reach this foramen from where this nerve comes out, and we actually put in a camera through this small hollow tube which is of the size of this pen, which is very hollow. The patient stays awake, is in the local anesthesia, does not feel any pain till the point this hollow cannula touches his nerves or the sensitive nerve fibers, he feels a slight pain, and then we put our camera inside the foramen and we see the nerves, we see the disc, and we take the disc, which is disc material which is compressing on these nerves, we clean it, we wash it, we see very small tissues, this small tissues we see under a big TV. Okay. So, we can very accurately take out the tissues which are causing this compression and help you get a relief from your pain. So, need not go for any open surgery in these cases, because in these cases we can help you by avoiding this surgery and going in for these percutaneous procedures which are way less invasive than the surgery. The main difference being that you do not get any general anesthesia, you can walk on the same day of the procedure, you can go to the washroom, come back, stay in the hospital for a couple of days, get discharged, and you can resume your active life within maybe 4-5 days or so. You will be given some precautions, but more or less you are mobile, you do not have any loss of work hours, and you can be very productive. This is one of the latest technique which is being practiced nowadays by the spine and pain specialists. Now, another reason why people come to us is not to avoid the first surgery, but how to avoid the second surgery, because many of the patients have already undergone one surgery and they still have this some kind of pain which is left, and the treating doctor has suggested them another surgery. Now, they do not want to undergo the second surgery. In those cases also, in many of them, provided there is no instability of this bony spine, we can help them by these procedures. There are variety of other procedures. For more details, you can always visit my website, and this can be avoided. If you want to know more on how you can avoid your spine surgery or your back surgery, then please do visit my website on www.pain.org.in, or visit my clinic website on painreliefcenter.in, painreliefcenter.in, or you can also visit me on my Lybrate website, which is www.lybrate.com/doctor Sidharth Verma, Sidharth Verma. Thank you for watching. Have a good day.